Thank you, Dr. Rathi. So, school eye health screening, why should we catch them early? Now, why school children? Because in India, uncorrected refractive error is the second most common cause of visual impairment after cataract. Almost 5% of school children have refractive errors with BCVA of less than 6/18 in the beta eye. Prevalence of myopia is almost 7% in the school age group in urban area, and it has been exaggerated into epidemic proportions because of the use of mobile phones after COVID era. Refractive error is till now the most common cause of reason of visit into an eye OPD. Now, going to the history, what were the problems in school eye screening in the previous models? If we see the gap analysis tool, there was no analysis of the failure of previous programs. So, our state, Odisha, on World Sight Day 5 years back, we launched a program named Sunetra or Healthy Eyes by the government, which is spread over 5 years with the bold message as eye care for all by 2022. Now, what we analyzed about the failure of the previous programs were that there was no gap analysis, and even if there was a failure to address them. There was inadequate manpower, unequal distribution of trained people in rural and remote areas, and there was poor quality of care, and there was no standardization. So the first protocol was a proper planning of the Sunetra program. Now on the right side we can see that this is the planning of the ongoing 4 months. Now each plan is of a duration of 3 to 4 months, and at the end of the plan and the end of the implementation we again do a gap analysis. Next is identification of human resources in that catchment area. That is all the ASHA NM workers, the teachers, then ophthalmic assistant and government officials. After that, the teachers undergo training and they issue a yellow card to the students who have been screened. If they are referred to an ophthalmic assistant or eye specialist, it is with the help of a blue card. Then we conduct the screening, that is mostly with the help of the teachers. The preliminary screening in the school, the examination is then done by the ophthalmic assistant, and then the spectacles are provided by the optician, and they are dispensed again by the school teachers. Now the arrangement for refraction of those who have lower visual acuities by a qualified ophthalmic assistant with proper provision in a dark room and trial set. He then sends the prescriptions to the optician, and there are two types of arrangement for provision of spectacles. Either free spectacles are taken from the optician, or there is direct payment of the amount to the guardian, and then they can do spectacles on their own. Most important step is monitoring the progress after every 3 months. That is evaluation of the screening program with these 9 questions which can identify any gap in the program and which can be subsequently analyzed. Now on the right side is the form of the monitoring list, and below it is the district wise distribution, which report is sent after each 3 months to the government officials as well as the district headquarter program officer. Now what were the gaps in the previous programs? On the left side you can see that the vision was just seen with a torchlight in a very haphazard manner by the teachers which were not trained. Now on the right side are the gaps which we have taken care of. That is, now there is a stringent record keeping. Then there is a parents teacher association or interaction every monthly, so that the parents can give the symptoms of the children, and we can know which children are at risk so that they can be evaluated better. Then there is insistence of glasses of children who are already wearing glasses. The teachers insist that they wear glasses regularly. And most important is, after the dispensing of the glasses, there is a 1-year follow-up, and the record is being kept to know the causes of non-compliance of the children who are not wearing glasses. Now, another gap in the left side, how the vision was being taken previously in a dingy room, and there is no standardization of the chart. Now, on the right side, we can see that now we have a standardized E-chart. This vision screening chart is white in color with only 5 black E optotypes equivalent to 6 by 12 of the Snellen's chart. This is provided to all the teachers in the school who are trained, and they just need to identify children with poor sight. They need not take the vision of all the children. They just need to cut off or benchmark the children having less than 6 by 12 vision and send them with a blue card to the optometrist. Now, this is again the flow chart for the teacher. If the eyesight is not good, that is less than 6 by 12, send him to the optometrist. He sees for any refractive error and dispenses glasses with the help of the optician. If any other complication in the eye, myopia of more than 4, then he is sent to the nearest vision center or the ophthalmologist. Now, apart from vision screening, there are integration of eye health screening like pamphlets for healthy eyes and how to prevent injuries for teachers and children. Now, these are the training for teachers to identify these common problems, and they are provided a kit with tetracycline ointment, eye pads and all to know which diseases they can treat at the school. I'll take just one more minute, ma'am. Yeah. Now, these are the diseases which the teachers will refer. Now, during Holi and Diwali, there is a parents-teacher interaction for special precautions, and especially children after class 8th, before they do their chemistry and physics labs, they are also given a special talk of preventive measures of injury. Now, apart from that, the teachers are provided free spectacles for presbyopia and free assessment of their glaucoma and diabetes so that their eyes remain healthy. Now, the Sunetra program is not a standalone vertical program dealing only with refractive error. There is integration with the Ministry of Health and Ministry of Education and the midday meal program. And most importantly, there is eye care for all, that is inclusive education in integrated schools for children with low vision. And under the Sarva Shiksha Abhiyan, they provided free low vision devices by the government so that they can study in the normal schools in an integrated manner with their peers. So why school children? Because it is the age of rapid physical mental development. They are exposed to injuries which can be avoided. They need to benefit maximum from the education program. And if we inculcate healthy habits, we are inculcating healthy eye habits in the future adult. We are guarding the school health and ensuring healthy adults for tomorrow. So we are undertaking this Sunetra program so that all may perceive and not merely see. Thank you.
Thank you, Dr. Misra. What you said is very true, that we have to catch them young so that the disability dallies would reduce for them and the quality of life, that is college, will increase for these.
Yes, exactly.
And both of you, Dr. Nanda and Dr. Misra, has brought out a very good point, that is now Diwali is coming and both of you have said that we need to work on that. Probably through AIOS we can have certain things which can be projected on TVs or WhatsApp messages or whatever way on digital media. We can prevent injuries for the kids. Any questions? We still have time because we have covered all the lectures. We have time for questions. Yes, there is one.
Ma'am, you have primarily focused on vision screening in school children. Do the direct portable auto reps have their importance in directly screening?
No, what we are...
No, you yours method was this one.
Yeah.
Have you any experience with this method that few centers
Portable autoref, I don't think that will be cost effective because you can't.
I would
Yeah.
interfere here because for pediatric patients you have to do
are cycloplegic?
No.
Yes.
so you cannot say that you would be doing.
So that cannot be practically used
Yes.
as a tool. Yes. Thank you.
I just wanted to ask a question to Pooja ma'am that I am also in this medical board and we are evaluating low vision patients
Yes.
for this NEET entrance.
Yes.
Ma'am, suppose there is a retinitis pigmentosa case or any case which is likely to worsen. So how do you certificate? You give a 40% permanent or 40% temporary? Because there is no specific guideline what temporary and permanent mean, whether it is likely to worsen.
Yeah.
So will
So
yeah.
there is, ma'am, there is this the original GFR of the government, which everyone follows for the UDID.
Yes, ma'am.
We give the percentage based on that, the one I showed. And the second is the MCI, which only we are following, the 16 centers for the NEET. So what happens is that when these students are likely to progress, and they're 30% today,
Yes.
this even is true for things, conditions which may become better after surgery, like keratoconus. So right now the child is waiting for a cornea. It's a scarred cornea, but he is 30%. So we give 30% and likely to change or valid for 1 year. We put that in
No,
because
where
that
do you
is
write,
so
do you write it
anything
temporary or
that's
permanent? That is
so yeah.
we are
So the
confused for that.
disease has to be permanent, but the percentage may be temporary. So the certificate can be temporary. So this is in the fine reading. If you see those documents, the disease has to be a permanent disease. It should not be reversible or this thing. And some treatable diseases like keratoconus, which may undergo a keratoplasty (PK), you cannot consider it as a regular treatment. But for cataract, you can't give disability to all
No,
cataracts.
that is not
So that is
considered
true.
also.
So the thing is that the disability should be permanent, but the percentage and certificate can be temporary.
No, can I interpret? There are clear-cut guidelines on this. You have to write temporary or permanent, where you can write temporary and permanent.
No, sir,
Only
there are
2-3
no
points are
guidelines.
there. You have not gone through the book.
Yes, sir. I'm
You have not gone through the book. The guidelines of office, there is a clear-cut guidelines where you can mention temporary or permanent.
No.
And second part is, when madam says that why the controversy is there, lot of patients has come from 30% or 0%, now they are going for 40 or less than that, or whatever the things may be. That is because the certificate when originally is created by a young doctor in the periphery. He has lot of pressure. Lot
So
of pressure
that's
from
one
the
of
local
points I
touts.
mentioned, the training and
Yeah,
the,
local touts are there, local sarpanchs are there, local politicians are there, and sometimes money matters also. So many things which gives them, why should I bother? Give him, if it is 0 or 10, give him 40.
40.
When he will go
That's
to the
happening.
medical board
And
by the
that's-
college, at that time he will be
So
screened.
that's the reason the
So that's the
16
reason
centers have to
for
be
that
really
reason,
even more
madam,
strict. Yeah, yeah.
we have written to the government of India for the 2-3 things.
Yes, yes.
So with that, they have got a warning also. Once we have written to the railway board also. And from the railway board, it has been concerned to the concerned doctors that they should not write all these things. After this thing, there is certain percentage has decreased in the working atmosphere. Moreover, there is a visual handicap ministry in the every state government. That is a public health industry. With that visual handicapped department, they also give a warning to these doctors who give a false certificate. And the regular notion is that regarding the one-eyed controversy is there. Every person has a little controversy. If I am blind by one eye, please give me 50%. So that
These
is
are the
a
fights that
general.
the children always
so
put up with
something
us,
has to be
yes.
changed in the modules also.
Yeah.
We are still there with 30%. And if it is 6 by 24, 6 by 24, it jumps to 60%.
Immediately, yeah.
Immediately from
no,
30.
40. It jumps to 40.
60%, madam.
No, 624 in both eyes, sir said, yeah.
Just one line
So
change.
it goes to
Yeah,
one line
very true.
changes, it goes to 60% in the new
So-
new line.
True.
in the new pro forma by the
618
MPCB
and
guideline.
624.
So it has been again, I'm in that board also. So we have also controversy that may change by the AIMS people very soon or in a recent past. Within a 1 year or 2 year, the government will change that guideline to again make a controversy of 30 to 40%. But malingering and these things will continue.
Continue.
So only this will
There have to be ways
this
to
is this will continue.
high index
And
of suspicion.
even if in a medical college also, they catch hold of the young doctors. The certificate will be given by the HOD, but examination is done by the assistant professor and all those things. And there are so many touts, both from the superintendent, principal, ministers, local touts. Some pressure is there everywhere to make it, please ma'am, what is there? The patient will get a seat for the medical college or engineering college. So, but only thing you have to ask your conscience that you are giving a genuine,
True.
you are not giving a genuine fellow means you are depriving a genuine handicapped person.
True.
If you consent to that, then
Yes.
only it can be done.
Yes.
Again,
And
this temporary and permanent, there is a clear-cut guidelines.
so in
in the
which,
visual handicapped board.
which state is this? Because it's
Odisha,
not
ma'am.
very
There is
Odisha?
no guideline
in
actually,
Odisha.
sir.
Sir, actually, in those 2 pages, which we read and reread and reread
No,
50,
there are,
80,
that is
200
not.
times.
You,
There's no
And then
guideline.
we've gone to the American guidelines and then seen that even the angle definition for the
Yes,
visual
10
field
degree or
is
20
actually
degree.
subtended at the center,
Yeah.
not from the center. So it's actually a diameter, not a radius.
is actually
so
the diameter.
Yeah, so there were very fine things which are not clearly mentioned in the protocol.
And we
Ma-
land
So
up
we
with
madam, it
need
legal
is a-
to
problems
give
because of that.
recommendations. Yeah. And so another thing that I always tell the students when they fight about this, about the fact that one eye is missing, it's 50% out of 2 eyes. So then we are supposed to tell the patients this is how it works, is that we tell them how much percentage of your life can you, how much percentage of your work can you do? Because disability is a functional disability. How many functions are you able to perform yourself, by yourself in your life? With a lack of one eye, you can perform actually 80 to 90, but the government is giving you 30%. So actually government is giving you 70% ability or 30% disability, whereas you can actually perform 90% of all your actions in your life. So that is when they keep quiet. This is the way the government thinks. It's not like 1 out of the 2 eyes is. So this is how we have to explain, and
so we
are
have to
doing
tell
it,
them
sir.
that
Yeah.
we are sympathizing with you, but as per the government guidelines, as we are government servants, we cannot go beyond our limitations.
True, true,
We have got
true.
our limitation, but we are sympathizing with you. That is the only thing, and then rest will take care.
Yeah, but it was
Thank you, ma'am.
it was indeed an eye opener for every one of us. Like, this is how it is happening. Thank you
Yeah,
for
but
that.
still we are in the controversy. Like if you give 40% and permanent, then only they're going to get the benefit. But we have faced legal challenges that we have given 40% permanent for some corneal opacity.
When
But
legal
after they have
challenges are
undergone-
coming,
Yes,
legal
sir.
challenges are coming.
Huh.
Now the government has told once the medical board gives a report, you cannot challenge in ordinarily or go to the
They come for the
superintendent, give
review,
a
sir.
comeback review. You cannot do a review. It is to be reviewed only after
By
the
the
order of the
appellate
High Court.
board.
Yes.
Yeah.
So our,
Ma'am, we have
after
faced
our
such
review is
cases.
straight away High Court, and then
Okay.
one of the other 16 has to see it.
Yeah.
So
Yes.
that is how it is.
Ma'am,
So
some
we'll take the last comment
ma'am,
from him,
just one thing.
and then we are close because
okay, ma'am.
it's like 10.
Thank you, ma'am.
Thank you so much.